Hi, everybody. Happy Saturday. Happy day after Valentine's Day. I hope you all had a great um, Valentine's Day. If you were able to get out and enjoy your significant other. Just wanted to come back on again today and share a little bit more about menopause symptoms. Um, Last video we talked about, I went back over the stages and kind of gave you guys some more symptoms of menopause. And today, I think I'm going to be able to wrap up some of like the common symptoms of menopause. So last week, well, not last week, last video, we talked about like period changes, the hot flashes, night sweats, some mood changes, fatigue, and sleep hygiene or poor sleep. We also talked about the brain fog. So today I'm going to get into the lack of sexual desire or libido, but I feel like I talked about that the last time, but it doesn't matter. I'll touch on it again. Going to also get into talking about some of the joint pains and muscle aches, also hair and skin changes. Going to talk about migraines because that's also something that can happen during menopause, and some vaginal changes. So last time I came on, I think I touched on a little bit of like sexual desire or libido, and that tends to happen to a lot of ladies during menopause. And with that lack of desire or libido, this is where the testosterone comes in, because as you guys can remember, I mentioned that we as women, we do have testosterone, but the testosterone for us is what controls our libido. Um, when our testosterone levels tend to drop, that's when we lose that interest in being sexual or being intimate with our partner. You know, that's a big thing for a lot of people. Losing that sexual desire or that lack of libido, because some people, I've had ladies tell me that, that's a big part of who they are, part of their identity. So, oh, wow. So, yeah, that having that drop in testosterone can have a lot to do with a lack of libido. So that's a big thing. If you're having one of those symptoms as a part of your menopause, you definitely want to talk to your doctor about that. Like I told y'all before, I'm not a nurse, I'm not a doctor, I'm not a nurse practitioner, I'm not a physician assistant. However, this is what I do on a daily with talking to ladies about menopause and kind of advising them and kind of putting them or helping them in the right direction and showing them how to talk to their providers when it comes down to menopause. So, if you're having that lack of desire or lack of libido, definitely want to talk to your doctor about that. One of the other symptoms of menopause is joint or muscle pain, and this comes when our estrogen also has a lot to do with our joints and our bones. So when we start to lose estrogen, sometimes you can feel like a little bit of tightness in your hips and in your knees or lower back, because the estrogen provides that lubrication that we need, everywhere, to make us feel quote unquote normal, make us feel good. My thing is, I have to slide a little oil to my knees sometimes when I want to go out, because I like to dance. Not that I'm a great dancer, but I like to dance. And sometimes you can feel that in your legs and in your joints when you go out, and you're not getting you don't have enough estrogen in your body to support that lubrication that you need to help those joints and muscles to prevent any like inflammation in the knees or in the hands or in wherever. Some people have, they feel like their fingers are always tight. Some people have hip pain. You can have the knee pain, the lower back pain. You can feel like your feet, like you can touch the floor and your feet just feel you have pain in the bottom of your feet or in your ankles. And all of this comes from that lack of estrogen that we are losing as it pertains to menopause. So that's so that's something that, you definitely you want to keep an eye on that as well. You want to also talk to your provider about that as well. Also, hair and skin changes. You can notice that, skin is looking a little bit more laxed, or, your face tends to start to droop, or your hair is thinning. That's because, again, all of this estrogen that we're losing, that estrogen helps with our skin, keeps our skin tight. It helps us to, it helps with your hair. When you're noticing those skin changes comes up to like that elasticity in your skin, like your skin just doesn't look as firm, or it doesn't, what's the word I'm looking for? You don't look as youthful. Let's go with that. Or you may notice that you might start to have hormonal acne. Some people experience acne. Some women experience acne as they get older, when they start going through menopause, and it's almost like you're going back into puberty, because the acne can be really bad. It can be either on the face or on the back. But yes, you tend to have that. You may notice that your skin gets a little drier at times, and you can have itchy skin. And personal story, for me going through menopause, I have experienced the itchy skin. And let me tell you, it is not fun, because you are literally like this, just, itching just for no reason. You almost feel like, for me, it felt like I had ants crawling all over me, because I was just itching so bad. And yes, I had put lotion on, all of that. However, that the elasticity and the essential oils that our bodies produce can also, that can cause you to have that itchy, dry skin. Another thing with the hair and the skin changes, you can notice that you have more facial hair. Now, most women who deal with like PCOS or hirsutism, they also deal with facial hair, but that's a completely different thing. That has nothing to do with menopause. As we get older, yes, we go through menopause, and the menopause can also, like I'm saying, give you those hair and skin changes. And you notice that there's increased facial hair. You can kind of notice like little whiskers on the chin, or maybe, that hair that you may notice more hair on the upper lip. So that kind of goes in with the hair and the skin changes. And then we can get into migraines. If you suffer with migraines before, now those migraines are going to seem worse because of menopause. Um, they can become more severe, and they can come closer together. So you definitely want to keep an eye on something like that if you are a sufferer of migraines. And then there is the all important vaginal dryness, very irritating vaginal dryness, urinary symptoms. So with women, our bodies, our urine, our bladder, and our vaginas are kind of connected. They're one. So when you start to have urinary symptoms, sometimes with that vaginal dryness that we get, that bacteria there is now backing up into the bladder, and it can make you feel like you might have a bladder infection. Or you can sometimes have a little burning or tingling with urination during the stream, or after the stream. And that's simply because of the vaginal dryness that you're having. The vaginal dryness can definitely make sex uncomfortable, because that natural lubrication that we would normally have, which would be that natural lubrication that we as women tend to have. But because we are losing estrogen and testosterone, that estrogen is what gives our bodies that natural lubrication. So now we're losing that. So this is where the vaginal dryness is coming in. The vaginal dryness can feel like vaginal irritation. It can make sex uncomfortable. It can almost be like, pins and needles, or some people has described it as the Sahara because it's just so dry. Yes, there are over-the-counter lubricants that you can use, but again, you want to talk to your doctor about those. There's all kinds of lubricants out there. There's over-the-counter lubricants. There's KY, which everybody is familiar with. But you definitely want to have a conversation with your doctor, because that's something, again, that you may want to look into, about adding more estrogen to your HRT therapy. So going back over all of the symptoms that we've talked about period changes, we've talked about hot flashes and night sweats, and the mood changes and fatigue and poor sleep hygiene, brain fog, which, for some people can be very, and I'm stopping on the brain fog for a reason, because brain fog can be very upsetting for some people, especially if there is a family history of like dementia or Alzheimer's, because it puts them in that frame of mind that, oh my God, something is happening. And the brain fog is just that. Brain fog can put you in a situation, you can feel like you can't find words. You walk into a room and you forget why you're in the room, or you could be in the middle of a conversation and just your thought completely leaves your brain. Like you just don't remember what you're talking about. Then, like I said, we talked about the sexual desire and lack of libido. We've gone over the joint and muscle pain. We've talked about hair and skin changes, worsening migraines, and vaginal urinary symptoms. All of these things are a part of menopause. And unfortunately, Daphne, gray hair is not a part of menopause. It's not a part of menopause. That is just what happens when you get older. The gray hair just comes. Can't do anything about that. We can't blame gray hair on menopause, but you can color your gray hair. So with all of the symptoms that we've talked about, that I've talked about with you guys, and these are just some of the common symptoms that you have, but there are so many others. And like I mentioned before, everybody's menopause journey is going to look different. Your menopause is not going to look like my menopause. Your menopause is not going to look like your cousins or your sisters or your best friend's menopause. Everybody's journey is going to be different, but we have to be aware of what those symptoms are and what to look for. As mentioned before, menopause, the average age for menopause tends to start at 51. But again, that could be different for everyone. Everybody's journey is different. Everybody's menopause stages are different. We also have to take into account those ladies who go into, who are quote unquote thrust into menopause because of surgeries or for health reasons. For instance, if you've had a hysterectomy and they have taken the uterus, cervix, and or ovaries, that can thrust you into menopause. Hence the reason why, if you have a hysterectomy and your doctor asks if you still have your ovaries, there's a reason for that, because the ovaries is where we get that estrogen and that progesterone. That's how we have those particular hormones, our body. That's what regulates that. Then you also have those ladies who have, who may be on chemo or radiation. They may, depending on what the reason for the chemo or the radiation is, that can throw them into menopause as well. But that's a different conversation for a different day. That's not where, that's not my lane. That's not my focus. My focus is just making sure that my ladies are, you are well informed about menopause, that you kind of know what to look for when it comes down to menopause, what questions to ask when you go to meet with your provider, whether it's general primary care, whether it's gynecology, whether it's a nurse practitioner that is doing your primary care work, or whatever provider you choose to see. You want to make sure that you're informed and you have all the questions and you know what to ask and you know what to listen for, and to also be aware of your body and know the changes and recognize the changes in your body. Because again, no one knows you like you. So when you do go to the doctor, I keep stressing this because I want you all to understand that you have to be educated. You have to be proactive in your health. In order for you to understand what is going on with your body, you have to understand what's going on with your body. So you don't want to let the provider tell you exactly what's going on and tell you what to do, because you want to ask those questions. You don't want them to just give you something and not explain to you why they're giving that to you. Okay, that's the first thing. But with menopause, let's just be diligent. Let's do our due diligence. Let's make sure that we understand what's going on. And me personally, I am going to try and come on as often as I can and give you guys information about menopause. But in the meantime, thank you for listening and thank you for watching the videos. I will also add my YouTube page to my videos because there will be some content there that probably won't show up on Facebook or Instagram. So again, thank you guys for watching. Thank you all for listening. As said before and as mentioned before, if you have any questions, comments, please inbox me on Instagram, inbox me on Facebook. I'm not quite on TikTok yet, but I do have Facebook and Instagram. So any questions or comments or anything that you would like to ask me or like me to talk about in future videos, please let me know. And again, thank you all. Have a great Saturday. Bye.